Hello guys, my name is Ani Rahmawati. I will give my opinion about study case 20. My opinion is yes, because Mr. M did not give his consent to the removal of his testicle. Under this circumstance, a testicle can be surgically removed only if the procedure is considered an emergency or life-saving procedure. If it does not constitute an emergency, the physician must postpone the procedure until the patient gives his consent. In this case, however, it must be assumed that the condition of the patient's testicle was not considered to be so serious as to immediately endanger the patient's life or health, and that there was reasonable opportunity to obtain the patient's consent for surgical removal of the testicle. And then, in respecting one's human dignity, we have respect his autonomy and require informed consent before performing any medical procedure. The patient, who will hear the consequence of the procedure, whether it is successful or not, must grant his informed consent prior to the performing of the medical procedure. To verify the informed component of informed consent, it is essential to ensure that the patient understands his present condition, the proposed treatment, and all of the possible consequences as opposed to other treatments, or to not having treatment at all. If the patient is not aware of this information, his consent cannot be considered informed. Nevertheless, there are situations where it is impossible to obtain the patient's consent, but he is still treated and everything is done to help him to improve his condition. An example of such a situation is the treatment of a person injured in an accident. Sometimes we are able to obtain the patient's consent to the treatment. Sometimes we are able to obtain the patient's consent to the treatment, but in order to do so, the patient would have to undergo some kind of additional treatment. For instance, it is possible to imagine a scenario where a patient is under anesthesia and we discover that there is an additional problem which was unknown in advance and for which we would need to conduct a different procedure for which the patient had not given his informed consent. This problem can be solved in advance if the patient appoints a legal representative who may decide on his behalf, and or if the patient is aware of such a possibility before the beginning of the treatment and gives his informed consent to an optional procedure in advance. According to the common point of view, if the patient is not in possession of the information in advance and did not give his consent to the matter, the new treatment must not be given and the patient's consent must be obtained. However, another approach claims that if the person authorized to grant informed consent on behalf of the patient is a parent or partner, especially spouses, then there is no need to stop the procedure. This view is acceptable in societies where the family plays a great role in the individual's life. This is my opinion. Thank you.